Kim Kardashian made news this week after she gave birth to a baby girl over the weekend, and already, not shockingly, it is stirring some controversy. It was rumored that the reality star was trying to plan an early C-section.
Always rumors with Kim Kardashian, but E! News is reporting the new mom delivered her baby naturally 5 weeks early, and it's why we have babies on the brain. In today's Doc Hollywood, we talked to an OBGYN about the do's and don'ts during pregnancy and some other female health issues. Take a look. Hey everybody, I'm here with Dr. Ruth Merid, an obstetrician and gynecologist at Regents Hospital. Nice to see you, Dr. Merid.
Nice to see you too.
Thanks for being here. Let's talk a little bit about this story that made quite a few headlines. This 66-year-old man from China learned that he is actually a woman, and he found out after being diagnosed with an ovarian cyst. So that has to be something that is very rarely heard of.
It's very rare that you see these genetic conditions.
In women, though, you're going to see ovarian cysts, probably relatively common. What are they, and what do we do about them?
So they are very common. Most childbearing women do have cysts. They can be as small as a pea or as large as a grapefruit. So it's when they're enlarged, people tend to have symptoms. They come in and see us, and that's when we consider surgical evaluation.
What are those symptoms? What are you feeling?
Usually pressure, pain, maybe some sharp twinges when they're doing exercises.
And so when you're doing the surgery, is it a big surgery? Is it a one-day kind of deal?
We're fortunate enough that we can do laparoscopic surgeries for these small incisions. They're usually done same day. They're able to go home and back to normal activities within a week.
That's great. So I know that you use that Da Vinci robot at Regents Hospital. I actually got to play around with it, do a little fake surgery a few months ago. It was very exciting. Would you actually use that kind of a robot to remove a cyst?
Yes. So cases where we have complex cysts, whether they're large or patients who've had many surgeries with a lot of scar tissue, the robot is a sophisticated laparoscopic tool that would work well for these patients.
And what kind of other surgeries would you specifically use that robot for?
So because I'm a gynecologist, I do many hysterectomies for people who are having bleeding, pain, fibroids. Those are my most common procedures. Patients tend to do very well because of these small incisions. Their recovery is much quicker and they're back to normal activity sooner.
And then there's Kim Zolciak from Real Housewives of Atlanta. She was supposedly caught smoking recently. Bigger problem, she's pregnant. We know that's a big no-no. So how do you help your pregnant patients when they say, I want to get healthy, I want to quit smoking?
Our advice is quitting at any point in the pregnancy is really the best thing that you can do to optimize the health of your baby and your health. First is asking, making sure that they're willing to quit, setting a date with them, actually signing a contract with them. The other is assisting, giving them quit line numbers, supportive cares, and then always arranging follow-up. At each of our visits, we ask how they're doing, we support them, we teach them relaxation techniques, we teach them ways to fight cravings, ways to socially avoid areas that would be temptations for them to restart smoking.
Is it okay for pregnant women to just quit smoking cold turkey, or will that be hard on the baby?
It would not be hard on the baby. We actually recommend that you can quit smoking immediately. You can cut back if that's the best way that would be effective for you to quit smoking altogether. Our goal is to make sure that you quit smoking during pregnancy and also quit when you're not pregnant in the future.
Okay, Dr. Merid, before we go, favorite baby name of all time?
Elizabeth, of course.
Good choice, Dr. Merid. Thank you so much for your time. I made her say that. It was, I'm going to confess it. I made her say that.
You sprung it on her.
Didn't she look surprised?
She's like, what?
She's so cute. She did a great job. And of course, we want to thank Regents Hospital and Health Partners Clinics for sponsoring the show. And remember to check with your physician if you have a health concern. And it has been really fun to kind of get to know these doctors.
Absolutely.
You know, sometimes you think of doctors as sort of separate from you and smarter and in a white coat and like they know so much more. But these doctors at Regents are so approachable. They always want to explain everything and talk through it. And so it's been nice to get to know them.
For the record, though, they are smarter. And they
are
wear
much
white
smarter.
coats.
And they look very good in their white coats.
Yeah.